All right, good morning, everybody. I'm hoping everybody can hear me. It is about 10:32 or 3, and we're glad to have you here for our SDAC Town Hall. Maybe this will become an annual event, but in any event, this is the second annual self-determination, that is statewide self-determination advisory committee town hall. My name is Rick Wood. I am the co-chair of the SDAC, as we call it, and I am just really happy to be here, and I'll tell you why. It is because instead of having a structured meeting where we have lots of reports and very important business to take care of, we're going to do something that I think is equally important, and that is to hear from members of the committee and members of the public, just as we did last year with respect to a specific area of self-determination, and that is or was fiscal management services, or FMSs. So with that, I would like to turn it over to Aaron to introduce an individual who I'm really happy to have joined us as our co-chair. Aaron?
Thank you, Mr. Co-Chair, and hello, all committee members. Aaron Carruthers, Executive Director of the State Council on Developmental Disabilities, and I'm very glad to come today and share the chair of our council, Wesley Witherspoon's decision in appointing Councilmember Nestor Nieves as the co-chair of this body, along with Rick Woods. Before getting too much into to Nestor, I want to just pause and honor, acknowledge, and celebrate and thank Rick for his, he's got the title of co-chair, but functionally he's kind of been a chair for a little bit and has provided such great consistent leadership for this organization, for this body that's really focused on its unique role and its significant impact that it can have within the self-determination program sphere. This is a great body of leaders within the program, and Rick, thank you so much for your continued leadership. With that, very glad to announce Councilmember Nestor Nieves, appointed by Wesley Witherspoon at the November meeting to be co-chair for this group. And Nestor joined the State Council on Developmental Disabilities in May of 2023. He has served on the Council's Self-Advocate Advisory Committee and the Council's Employment First Committee and the Council's Legislative Public Policy Committee. So bringing a lot of council and leadership and committee experience to this role. Before that, he also had a lot of board experience and leadership experience. He was including serving on the board of directors for ELARC. Nestor is a participant in self-determination and has really taken up advocating for greater control of services that individuals receive. And I'm excited for his role here as he carries forward his passion about empowering others and reflecting on meaningful change. So with that, thank you all. I just get to deliver the good news that Chair Wesley Witherspoon made, and turn it back over to Rick and Nestor.
Yeah, thanks so much, Aaron. And I share that as well. I'm really glad to have a co-chair that has been vacant for some period of time. I look forward to working with you, Nestor. He and I are going to be participating at the beginning, just before the public comment portion of this, or the public portion of this town hall. We're going to report to you examples of things which perhaps have worked or not worked for us in the self-determination program to try to kick it off. And so we will hear from Nestor just a little bit later. Robin, I wonder, well, first of all, if we could go to the next slide, and Robin or Beth, could you walk through the housekeeping and logistics for us?
Absolutely. I'm going to actually turn that over to Beth, and she's prepared a couple of slides to go through for everyone.
Thank you. Good morning, everybody. I'm Beth Kern, SCDD staff. I'm here to help with facilitation today. I'm just going to briefly cover some housekeeping and logistics. We have captions here. If you want to view captions, you can go down to the meeting control toolbar and click on the closed caption icon. We also have ASL interpretation available. We are going to spotlight the ASL interpreter so that they're visible throughout the webinar. If you need to access Spanish translation, you can use the interpretation icon at the bottom of your screen and just select the Spanish. And we are recording this webinar. We did the same thing with the last one. We're going to go ahead and post this on our on the SSDAC webpage, and we'll distribute it out to members and to attendees as well. Usually that will take a day or two for us to make sure we get it up and clean the video up for you, but you will be able to view this if you need to in the future. Can you go to the next slide, please? So this is a webinar. It means you're only going to see the committee members who are on camera and the speakers who were invited. You won't see committee members who've chosen to stay off camera or other members of the public. And this is a town hall meeting. Public comment will be the primary focus of today's meeting. If time runs out and you're not able to share your comments live, you can submit them through our comments link. I sent that out prior to the meeting. It's in the chat now as well for you if you just prefer to submit your comments in writing. All comments that are provided today verbally or through the link will be synthesized later and shared with DDS. Next slide, please. And we're going to pass it back to you, Rick. Thank you.
Yeah, thanks, Beth. So we put this slide up to kind of remind those who may have heard of the SSDAC, and I know that the information on this slide is going to be very familiar to committee members, but we wanted to put it up to remind everybody who we are and what we're doing and why we do this 4 times a year. And so the first sentence or paragraph actually provides that the SSDAC is comprised of the chairs of the 21 local advisory committees or their designees and a council-appointed co-chair, and that, of course, is Nestor. So I've been doing this for a couple of years or more now, and while I really appreciate these quarterly meetings, I know that we have these meetings for a purpose, not just to have them, but to accomplish something. And so the statute that was enacted now 11 years ago in 2013 provides that the SSDAC is responsible for identifying best practices. I know you've heard me use that term a lot. And also to identify effective training materials, implementation concerns, and systemic issues. The committee also makes recommendations on ways to enhance the SDP. And as an example of that, after the town hall that we conducted a year ago, we gathered or put together the input that we received from the public and committee members. We then had a meeting in, I believe, February, in which we sort of finalized what we wanted to send to DDS by way of comment and also recommendations, and we did that. And DDS has responded to that, and you're going to see that a little later in this program. And so this is an example of something that DDS has requested, which is that it receive from the ground up information from members of the public and those that are involved in the self-determination program, information about what's going on, what's working and what's not working. So this is simply a reminder. Next slide, please. All right, so we've got 3 things here. We want to hear of both successes and barriers. And we want to combine whatever it is that you might have to say about the self-determination program or parts of it with your recommendation for changing or improving it. As a practical matter, it is those that are experiencing it that will provide us with the most important and relevant information that we can then put together and by consensus or vote of the committee in February, decide or determine what is going to be presented to the department. And obviously, what we're doing is we're looking at problems with ways to try to resolve the issues that have arisen, and for everyone to hear that which is on people's minds at the same time. What I would like to do, just very briefly before we go to the DDS update and the Ombuds update, is if I can, whoever's managing the slides, go back to the very last slide that is entitled Guiding Questions. There you go. So we put this up, and we're going to put it up again. It's going to stay up during the comment period because, we talk about the principles of self-determination a lot. Those of you who've been in this gig for a long time are familiar with them, but it's really worth remembering that we've got 5 principles: freedom, support, responsibility, authority, and confirmation. These principles were developed 24 years ago, when the pilots, the self-determination pilots, were established among the 5 regional centers that were fortunate enough to be in those pilots all those years ago. And so what we really want to do is have you guys think about, as you're making a presentation, think about which of the principles are applicable when you are providing information and comment, because ultimately we want to relate that which we are experiencing back to those 5 principles. The reason that we've done this is that we really feel like, at the suggestion of one of our work group members, which was a great one, that which you can tell us can be and should be connected to the principles which are, first of all, embodied in statute, and secondly, are guiding for us. And Nestor and I are going to open in a short while with examples that might relate to one or more of those principles. Freedom. Really, it's freedom of choice. And as my son was in the pilot for nearly 25 years before transitioning to the self-determination program, for me, the first principle is the one that speaks the loudest and resonates, and that is, instead of being told what your choices are, you may make them on your own. The support principle is really important as well, which is why we've got a structure that includes an FMS, which includes an IF, which includes a service coordinator, which includes outside advocacy groups, which includes SSDAC, and finally, which includes the LVACs, or local self-determination advisory committees. And all of those are really important for those who are participating in order to achieve the goals and objectives that are set forth in a person-centered plan. Responsibility, I'm going to just spend a second on that. There is a responsibility, as we all know, that goes along with self-determination, because we are accountable to the government, to ourselves, and to our families for the funds that we receive from the state, that are, in some portion of those come from the federal government, that are designed to assist us in implementing a strategy or strategies to meet our goals. And so we have to be accountable. It's not just free money. But money is what allows us to obtain the supports and services that are otherwise, in many instances, not available in the traditional delivery model. The fourth one, in my mind, is kind of like the first one. They go together, and that is authority. Who's in charge? And my longtime friend, Harvey Lapin. Who can forget Harvey Lapin, one of the founders, really, of self-determination in California, asks the question always, who's in charge? Who's in charge? Who gets to make decisions about his or her life? And as we all know, planning is person-centered, and so it is the person and the family who is in charge. And then finally, confirmation. How can we ensure individuals feel acknowledged in their self-determination? What recognition and validation are most meaningful? And so that recognition and validation comes in a whole variety of ways. And in my mind, it happens to fall on service coordinators and regional center staff, as well as the department and this body, to affirm those things which work for people to achieve their best lives. So there's my off-the-cuff thinking about guiding questions, and we're going to put that slide back up again because we want everybody, if they can, to focus on those principles and relate their experience to one or more of those principles. So enough of that from me. What I would like to do, if we could, is go back to, I believe, about the fourth slide that takes us to the Department of Developmental Services and Ombudsperson updates. And there we go. We've got to go one more, I think. Well, actually, one more. Here we go. And what I'm very happy to do, if it's all right with you, Beth and Robin, is to turn this over to whomever wishes to speak. I think we actually have a Katie and a Katie. And I don't know whether the two of you have determined who is going to go first. And so I'm going to turn it over to both of you and have you decide who's going to give a presentation first.
So we try to make it easy, Rick. So if you just say, Katie, talk, someone will talk, you know.
And Katie and I decided we were going to rock, paper, scissors on camera today to determine. So no, I'm happy to go first and provide some overview, and then have Katie Hornberger help us with some of that ombuds. So as your slide depicts, our policy side will kick it off for you today. Thank you so much for having us. My name is Katie Dempsey. I am the branch manager that oversees the self-determination program in the Policy and Program Development Division. So our team is really the team here at the department that's working on the implementation of the program. That means writing the directives, renewing the waiver, providing technical assistance and support to our regional centers, and a large variety of different opportunities for community engagement. We partner well with our ombudsperson office, but we each have our different roles. And so that's had to tell the difference in the two Katies. Katie D, Katie H works for us as well. Or again, like Katie had mentioned, either one of us will respond. We're chatters, so always happy. With that, and in the spirit of town hall style, generally we go through all of our data, and hearing a request to send that in advance, we did send out the data for the current demographics for the self-determination advisory for the self-determination program right now. And I'm not going to go over them line by line with you today because we want to keep this conversational. We want to keep this about updates. And so you will have that in your packet of the current demographics. And I'll just highlight a few things before I share my presentation. Everybody, I always find, like, what are the numbers or the hot topic here? So where are we at? As of October, the end of October, we had 5,502 participants in our self-determination program. We're averaging about 144 participants per over a period of 6 months, 144 per month. And you'll notice, and I notice at least that over time, that seems to have reduced in these last few months. We were up at 170, 180, and that's because we're seeing a trend historically that June and July are lighter months. And that makes sense, right? We've got a lot of things that kind of factor into why we tend to have lower enrollment in June and July. Things such as it's the end of the school year, people are going on vacation, and let's be honest, it's also fiscal year rollover for our regional centers. So there's some components there to look at. It's an interesting trend, but I anticipate we'll see that monthly average continue to grow over the next months. Last month, we had 237 participants enroll into the program. So again, just accounting for those year over year slower months in that summertime that we tend to see that dip in numbers. With that, again, those are my highlights for the data today. And our presentations attached in the materials. Happy to take any questions on those, but I really wanted to spend this time together talking through what Rick had indicated. What are those recent updates that we have? It's been some time since we've met, so we'll breeze through a couple of those, and then how is the department looking at these recommendations that the SSDAC has provided? What current efforts do we have to implement those and move things forward? So I already have a hand here. Hey, Debbie.
Hi. I have a question.
Yeah.
There's a couple of SDP pages on Facebook, and people do a lot of complaining on that. And I was wondering if you guys monitor both those pages. And the other thing about that is whether they've got some control over the FMSs, because it seems that still seems to be a problem. At least when I'm looking at those Facebook pages, I always respond and try and send them to you guys in the ombudsman's office. Anyway, that was my question.
Yeah, thank you so much. And that Facebook page is the one, and I know might be a couple out there that State Council has put together, and
there's one that Henny runs. Yes.
Okay. Yeah. There's a couple different ones out there as well. And what I can tell you is that information does get to us. And while, the day-to-days of my job is not always, monitoring the Facebook, we are aware of the concerns out there, and always appreciate when people bring those forward, appreciate the participation that happens in those groups, the sharing of accurate knowledge, dispelling of things, and just the, State Council offers one of the spaces for people to connect in them. So we're often aware of the things that are on there, either through word of mouth or hey, have you seen this? And use it as a guiding point for, a feeling of what's the climate out there right now. So we see the value in those, and use that feedback and appreciate when people bring that to the table for us.
So if somebody says, hey, my regional center won't approve a camp for my, funds for a camp for my child, you guys don't step in and say, hey, maybe we can help?
I see Katie's shaking her head here. Our ombuds office, and Katie will bring you in a little bit more, does a lot of that individual case management type interactions. Our side, which I'm going to share with you today, is really focused on that policy. And so, we do encourage people to make referrals to the ombuds office and encourage anybody participating in that Facebook page to do so as well.
Okay. All right. Thanks.
Yeah, no problem. Thank you for the question and the comments, Debbie. Appreciate it. Okay, with that, I'm going to go ahead and dive in. Okay. All right, Kavita and David, I'll take you, and then I do want to get into our presentation a little bit. How you doing today? And David, I see you're speaking, but you're on mute.
Go ahead.
We're doing good. We're
Great.
doing good.
Thank you, Katie. Sorry, I didn't realize that you were going to get into the presentation. I just had a quick question about some of the data on the presentation. So, are we going to go over that right now, or are we like?
I'm happy to pull up the data if you guys want to spend the time on the data.
No, there's just one thing that it's slide number 10. I mean, are we going to go through the slides, or are we?
You know, I didn't intend to, just because I heard our intent for today was really focused on how feedback's incorporated, but we did still want to provide that data to you all. But if there is a specific piece of within the questions that you have about our demographic data, I'm more than happy to pull it up and walk everyone through the data.
I just wanted to understand how to interpret it, because in terms of on slide 10, you say SDP participants compared to all regional center consumers age 18 to 22. If you look at the regional center consumers, I mean, I don't know how to read this. So it says the orange bar is 10% of regional center consumers, and those in SDP are 15%. So could you kind of, just in plain language, explain it to us how this was, what actually this means?
Yeah, absolutely. Let me go ahead, and I'm just going to pull up the slides just in case others have not had an opportunity to review those as well. And let me I should have screen share ability. And I appreciate that you all want the data and the breakdowns of the data, because that is really where I start to kind of nerd out a little bit. Okay. Let me go ahead and share my October demographics. All right, so as I had mentioned here before, and we will pull down to that, can everybody see this okay?
Yes.
Thank you. All right, as I had mentioned, we have that 5,502 data point for the end of October. We continue on that upward trend for our enrollment into the program. Here we have a breakdown of enrollment by regional center. We can see our smallest regional center, Redwood Coast Regional Center, is all the way over on the left side, and our right side, Inland Regional Center, is our largest regional center. So you can see the variability. We've presented this in a few different ways. This is just raw numbers, but we've also seen value in showing these as the percentage of people that are participating in the program at the regional center. I really love this slide right here. And again, I'm just giving some brief overviews today so we know what to take away from it. I love this slide right here because it shows the year-over-year enrollment by regional center. And so it looks very similar to the last one. It goes through the end of the fiscal year. So it would be through the end of June in 2024. And it shows the growth by year. So if you look at orange, it's everything in that soft rollout through 2021. Then we see our blue is 21, 22. Our yellow is that following fiscal year 22-23, and then the last fiscal year is 23-24. So you can see here that there are some regional centers that maybe had a slow start and over time have grown. We can see some regional centers that had a really high start and then maybe reduced. And then finally, you can see regional centers who have just been very consistent across time. So it's interesting to look at and have conversations on your local level to say, hey, it looks like we were doing really great in the beginning and we hit things really hard. And that following year, things kind of slowed down. What was happening? It could be a variety of things, right? Maybe there's changes within your community, changes in the regional center systems. There are so many different things, but I'd encourage people to look at that data and say, well, what was going on this fiscal year, or what were the successes that we had that really skyrocket our numbers during that time? Maybe tying it to a certain implementation funds initiative that you had, where you saw a greater enrollment during that time period. So I'm always a fan of this slide here. Here's our ethnicity, overall ethnicity, but of individuals that are in the program. So our blue side is going to be our self-determination program participants. Our orange is eligible regional center population. So that would not include early start, wouldn't include individuals that live in, say, skilled nursing facilities. So status 2 is the term that regional centers use, but that's a little jargony. With that, your blue side, you'll see, for example, we have our an overrepresentation of Asian and in the self-determination program, an overrepresentation of white, and then we have our Black, African American, and our Hispanic populations seen here, which have an underrepresentation. So thinking of those when talking about your local volunteer advisory committee, your implementation funds, your charge, how do we reach out to these communities to make sure that they have the information in ways that make sense for them, and make the program accessible to them to help reduce those disparities? We then look at the regional center individuals by age. And so you can see here that we have just a smaller amount of individuals in that 3 to 17-year-old category that are participating in the program, as opposed to those in the statewide. But we're seeing this growth in the transition age areas. So 18 to 22, we're seeing this is starting to become a higher representation in the self-determination program, as well as with adults. And then we have a lower representation in those individuals that are over the age of 55. The next one here that we look at is by disability type, as identified with their regional center, and we have an underrepresentation of our intellectual disability, overrepresentation of autism. Cerebral palsy is just slightly overrepresented, and epilepsy in our other category are just about neutral, others a little lower. And then lastly, we have language. So we have an overrepresentation of those in the program that are speaking English, and underrepresentation of those speaking Spanish. All right, and I'm gonna go ahead and pop over to the next slide here, because I think that that's the 110 that Kavita was asking about. And what we do here is we have a cross section. So we're looking at ethnicity for a specific age group in the program. So of all of the individuals between the ages of 18 and 22, this is the ethnicity breakdown for those individuals. So the blue is going to be our self-determination program participants that are between the ages of 18 and 22. Our orange is going to be our total regional center population of those eligible individuals. And so here we see there's an overrepresentation of Asian and those that identify as white. And then we have that underrepresentation of Black, African American, and Hispanic. And then we have that other category, which I think we can all, we're all looking and waiting to dive deeper into, right? Where we have some enhancements coming out within our system to provide more targeted data And that is, we're hoping we'll be able to start breaking down that data so that it's de-identified, or so that it is de-identified in a way that we can present it to the community at a further level. And I know Lisa has her hand up, and I want to see if your questions about the data, because I see Kavita's got her hand up as well, and I think her question is about data.
I'd like to pause and just check in with the co-chairs really quickly and wonder if the co-chairs would like people to hold their questions till the end of the presentation and just keep them writing so we could stay on track and be sure that we get through the whole agenda today.
Yeah.
It's up to the two of you, but I could absolutely track questions. I know we have 2 members with questions, and then we also have a hand up in the audience, and I'm happy to start writing those down for you if you'd want to move on.
Yeah, thank you, Robin. One of the things that we talked about as we prepared for this meeting was to what extent were we going to spend time on the data itself, and that's the reason why the department was so good to present this material that is really very familiar in its format because we see it quarterly. What I would like to do, if it's okay with everybody, we're going to have an opportunity for members of the public to weigh in as well as provide a comment. I'd love to have everybody wait until first Katie Dempsey's presentation, and for that matter, Katie Hornberger's presentation has been completed. And if there's something, if you've got a burning question, feel free to put it in the chat. One of the things that we know from this data, I mean, I see it 4 times a year, if not more often, is that we still have a lot of work to do in the area that we call disparities. And I know that there are a lot of things that are being thought about in an effort to address the disparities issue. But what I would love to do, Katie Dempsey, is have you conclude yours, and then Katie Hornberger conclude yours, and have everybody save their questions until the end. The focus of today's meeting obviously is for members of the public, but it is also really important that you hear from DDS. At least it's important to me that you hear from DDS and the ombuds as well, because they're the ones that are in charge of this program and helping people in and out of it. So that's my thinking about the order of things. And Katie Dempsey, if you could continue on. Thanks, Robin.
Thank you. And Katie, I started a list, so you can just turn to me. We have Lisa Cooley, Kavita and David, Celine, I see you're in the audience, and then Judy Mark, also a member of the public.
Perfect. Thank you. Appreciate it.
Mm-hmm.
All right. So with that, we're going to pivot real quick, and we're going to move into our presentation today, which is really about what's been happening and what we have moving forward, and some of the recommendations that have been made and how we're looking to incorporate those. So I'm going to go ahead and jump right into, it's been a while since we've touched base, and I'm not going to spend lots of time here, but we did have a variety of directives that were released out back in July that focused on different aspects of the program. We had one that required annual reporting of local volunteer advisory committee composition. So each regional center submitted a form that provided that information, and will do so annually. That's a part of trailer bill language that came out in 2021, so it's a statutory requirement. We also did some updates to pre-enrollment transition supports. One of the big takeaways was allowing for the general self-directed supports, many of us call it 099, to be participant directed. And we did an update to our goods and services to add coordinated career pathways as an available service outside of an individual budget. Well, why'd it go the wrong way? Okay. Then finally in July is the one I just chatted about with the coordinated career pathways. And we just had a new directive come out pretty recently, and this was a directive that extended our weekly payments from regional centers to financial management service providers until further notice. So we know and recognize that getting those weekly payments from regional centers has been tremendously helpful to our FMSs in ensuring that they're able to make timely payments for those that they're employing, providers, making sure that the billing process is as smooth as possible so that we're supporting those FMSs. With that, I'm going to go ahead and change directions here, and really just wanted to take a moment to recap on high level the recommendations that were sent forth by the SSDAC from the FMS town halls. And I'm keeping this high level so that we can have that conversation around it and can kind of understand where they've been incorporated. We have a lot of work on the horizon, much of which should be pretty close to coming soon. And we're going to be talking about that. And really, we're going to be focusing today a lot on the FMS standards. And as a reminder, the department is in development of FMS standards, which will set forth the qualifications, requirements for the knowledge and skills for our FMS providers. And the intent behind this is to create a consistent service delivery of FMSs across the state. So our standards will include what those qualifications, what the required skills and knowledge to become an FMS provider is, and then what are those core components about providing supportive and adequate FMS services to participants. So I broke this down into general themes that were set forth in the report provided to the department. The first of those were delayed missed payments, and the recommendations were really around providing FMSs with procedures related to spending plan activities, monthly statements being accurate, ensuring that payments are made in a timely way. And as we continue to develop these FMS standards, these are all places that they fit nicely in order to say, this is the way in which the expectation is set for making sure that payments are done accurately, making sure that payments are timely, and making sure that everybody that needs to know about those payments has that information. The second topic area that the recommendations were made around were standardization. So creating those written standards, as we've been mentioning, including contracts between FMS providers and regional centers, how FMSs communicate with participants, regional centers, and independent facilitators. And again, these are in development, and I will tell you there's a big focus on the most important piece of it, which is customer service expectations and participant experience. So using these standards as a way to really drive and focus. I know we're talking about the 5 principles today. How are we incorporating those into the standards? How are we looking at the participant experience and the impact on the participant that these standards have as well? And then there was a recommendation around employer burden and standardizing that. And that is something that we did release a directive on, the standardization of those employer burdens. I'm just hitting the wrong button, you guys. Okay. 2 other topics that recommendations were made. The next one was around training participants and families where additional training is needed. And some of those trainings, recommendations were around employer readiness. What is it for a participant to be able to know how to be an employer and to manage staff and to understand what the rules are, like when their staff needs breaks or what to do if things aren't going well with an employee. And so I think we have a couple opportunities here for it. And that includes our work, the department's work with State Council on the development of additional orientation modules. So we're working really hard to get those forth. And that will provide 5 additional modules. They're not required, but they'll be available to anyone who wants to go through those additional pieces to have a more in-depth understanding of the program. We're working on implementation funds directive and hoping to get that this fiscal year out with, again, that focus on training. This is a great area where we can include training on employer responsibilities, telling people about it, especially as they're getting into the program or interested in the program. What does that role and responsibility look like for you? And then our FMS standards really look to support what role does the FMS play in providing information to the participant. And that could be a variety of different things. It's information about how to access their portal. It's information about and training about how to communicate with that FMS. It's information and training about what the policies are around being an employer, or what types of things they need to know in order to make sure that their employees get timely breaks, that they have appropriate supporting documentation in order to help reduce any liabilities. And then finally, there was another category there about improving communication between FMS's participants and families, having created clear and understandable contracts. Again, this is something that is important, and we look to develop within those FMS standards. There are components such as a service agreement for participants that FMSs need to make sure that they are being clear about the services that they'll be providing to our participants. So that's another way, providing information around onboarding handbook, a participant handbook, all of that being set forth as policy, as a requirement for our FMS providers. And I will just take a moment to say, I'm talking about these FMS standards pretty broadly right now, but I do want to acknowledge that we've received a lot of feedback from our SSDAC and from our other from advisory committees, FMSs, regional centers, and so we've been able to really pull together all of that feedback and work to develop something that I think is going to be very clear and understandable for everyone to use and navigate. Our FMSs are certainly going to be able to navigate these. So with all of that, we're also working with Applied Self-Direction on a certification process for our FMSs. So while we have the standards in place, how do we ensure that they have the understanding of the standards? And then how are we intending to monitor those? What happens when, someone isn't following the standards that we're setting? That's all being set forth in our certification process and ongoing monitoring. All right. And with that, we have some of the areas of focus that we have right now. We mainly spent our time today talking about those FMS standards and certification. We're also in development on those independent facilitator standards and certification. We have a contractor that's working with many members of our community on the certification process and what that will look like. Additionally, we did up there, we got a green check. We did receive data from regional centers. They had to have it in by the end of October, many of which got it in earlier, which we appreciated. And now we're in the process of analyzing that data. So those data points will mark from orientation to when someone has a budget meeting, to when that budget meeting is certified, to when they have their IPP. We're looking forward to being able to start sharing some of that data soon, as we've dug in and started analyzing it, to be able to say, you know, on aggregate as a whole, how quickly are people moving through? When are we finding that things are moving a little bit slower? Do we see trends at one regional center versus another? How do we evaluate the successes and see what's working in some areas? Because we know there are certain areas or regional centers where growth is happening quickly and readily. And so we'd love to be able to point to it and say, how is that happening here? And what can we do to kind of share that with others? All right, with that, I'm going to stop my portion and hand it over to Katie Hornberger.
Thank you. Oh, and I have exciting news. We have hired an SDP ombudsperson. Yay! And this one, I'm not going to let DDS policy poach. And Marlene Morales is our new SDP ombudsperson, and Marlene's actually flipping slides for me today. I'm hoping, can we spotlight Marlene also so she can just say a few words of welcome?
Sorry, also, I was listening to you very intently, Katie. Hi, everybody. I am very excited to have joined the Ombudsperson's Office for self-determination. So I am very excited to be working with the community and with everybody to try and continue to work on self-determination. So thank you, Katie, for introducing me today.
Yes, so really nice to have Marlene. I will toot her horn as she does not do that. She is bilingual, bicultural, speaks Spanish, also has her license in marriage and family therapy counseling, has a background working both with our clients and in behavioral health, and was involved in the self-determination program at Orange County. And is really excited about being able to look kind of at this statewide thing. You know, I think when you're at a regional center, you get this little view of the world. And the fun thing about being an ombudsperson is we get not just 21 regional center views of the world, we get a couple views from some regional centers. So we get more than 21 views, which I think is a lot of fun and gives us a really unique perspective on the program. So with that, I'm going to get into some data, tell you all what we've been doing for the last couple of months. And Marlene's going to share our slides. And the first slide is around this is what I know everyone cares about, which is what are people calling about? It's our the category of the contacts. This is not going to surprise anyone. This has been true, I don't know, the last 6 times I've met with you all. FMS is the topic that is most called. And within that, there's a variety of things that people call about. It is often related to late or missing payments, but that's not all. It could be onboarding, it could be background checks. We also get calls from a variety of sources. So sometimes it's families or independent facilitators or individuals calling us about their FMS. Sometimes it's the regional center calling, and sometimes it's the FMS calling us also, because they're struggling with how to do something and want to be able to talk that through with us. We also continue to meet with, the bulk of them on a regular basis. We've had a number of new ones pop up in the past couple of months, and we're starting to get scheduled with the new ones also. That gives us an opportunity to not just talk about individual matters, but also to talk with them about what's changing in their program, what's not changing. That way, when people call us, we have more accurate information to be able to assist them with how things are going at their FMS. And if sometimes like people will call and we just talked to your FMS, that's because, and we can help really communicate some of those messages. The next highest category is regional center. And that is both people calling saying, my regional center is or isn't doing X, can you help me? And sometimes that's even regional centers calling, once again, saying like, help us talk this through. I will tell you all, SDP is hard and there's a lot to talk about because it's individualized. So the same thing that makes it really great, also makes it really hard because people will say, Katie, can I have pool noodles? And I'll say, I have no idea. I'm not on your planning team. Not a clue whether you can or not, because maybe for someone and their planning team finds that that is a need that needs to be funded, another planning team may not. Next up is general information, and general information, exactly what it sounds like. It's people just getting started in the program. That continues to be a high number for us. And I saw someone in the Q&A raised as regional center understaffing contributing to some of the things that we see. I think definitely. I think service coordinators have really hard jobs and really high caseloads, and providing information about SDP is not in some of their skill sets, unfortunately. Luckily, we've got a team who it is in their skill set, and so we get a lot of people calling, and we really walk them through the process and give them tools to keep going. So that's just the general overview of our contacts. I do want to show you, the next chart is our calls that regard FMSs over time. And, I think this chart is fascinating because oftentimes, especially some of them in 23, I could match to when directives came out. And so, that gives me hope that like we're kind of making some good decisions and setting some things right. But the high number of calls we still really receive really tell me that there's more to be done. And I think, as Katie said, they're, continuing to look at things and try and make changes. Let's go next to by regional center. So what's interesting about regional center is if you look, like our top two, Inland and North LA, two of the three biggest, largest regional centers in the state. You look at our smallest, Redwood Coast, far northern, two of the smallest. The middle though is a jumble. So there's some matching. I think, also some of that has to do with communities that are more familiar with the ombudsperson office. Because we've done more outreach there, or because we come from that area. And so people are more comfortable reaching out to us. Next up, we've got contacts by caller type. That's who is actually calling us. And you'll see the majority is parents. And then next is independent facilitators, and then others, and then regional center staff, and then individuals call us FMSs, as I said, and then sometimes we don't have a relationship coded, and then some conservators. And I will tell you, I'm sure some of those parents are also conservators, but didn't identify themselves as such. This is not surprising. I think to me, this chart looks pretty much like I would predict, and pretty much the way when we opened ombuds, we thought it would sort of go. I love working with individuals served, so I would like that number to be higher. I will also tell you, when parents and independent facilitators call for adults that are served by regional centers, we do ask to speak with those adults and get their consent before we would take any action. And lastly, just a reminder, we've got our website. We also have a data dashboard on the website that you can look at and kind of, run your regional centers, see what kinds of calls we're getting in your area. Our email is super easy. We've got our toll-free line. Our line is open live from 10 to 3 each day. I will tell you, we've had a really high volume of calls in the last 2 months. And so sometimes even when the phone lines are open, we're on another line talking with folks. So if you leave a message, we'll always get back to you. We also have an intake form on our website. You can fill that out and we can get back to you that way. So that is kind of what we've got going on. And I know David commented that, sometimes individuals served are worried about retaliation in calling us. I will tell you, when you look at that slide by regional center, what you'll see is 42 out of 411 are unknown, and that's when people don't tell us, and people don't have to. People don't have to. We have some people who don't tell us their name, and that's okay. The goal is for people to be comfortable, and the more information we have, the better we can assist. But lots of information, we don't need to know what regional center you're from. We don't need to know your name. And so we try to really ensure that folks know about confidentiality. Everything the office does is confidential. I can't talk to the regional center about you unless you tell me I can, and we will always ask. We really do try, to do what we can to reduce that fear of retaliation. Although, David, I'm sure that for some folks, that fear is too great, unfortunately. So, good point, David. Thank you.
Katie, thank you. I'm before we go to questions, I happen to really like the data aspect of it, provided that it doesn't take the whole meeting. And it will elicit questions. I want to say this. One of the things that just really jumped out at me was in the slide in which you indicated, or you cataloged how many calls were received by regional center. I mean, this is amazing. San Diego has the most enrollees, and they had 7, count them, 7 calls, which, I don't know how to interpret that, but I know, Katie Dempsey, that's probably something that you would want to interpret, because I got to believe we got to learn something from that. We've got this outstanding performance, but now I understand they're a very large regional center, and so you would expect their numbers to be higher.
Right.
These percentage-wise, but I was absolutely struck by the very small number of calls to the Ombuds office by a regional center that was outperforming nearly all other regional centers. And so that's just a comment that I make.
Yeah.
Robin and Beth, I wonder if you could manage the questions. We haven't gotten to the main event yet, guys, but we're going to get there, and we want to hear from you. So if you've got questions, if you could, Robin, if you could manage that, please.
Sure. So I'm going to go ahead. There are several questions in the Q&A, and if we have time to get to those, I'm happy to read them out loud, Katie, or I could also email them to you after the event, and we can make sure to post responses to those questions.
Happy either way.
Okay. So first, Lisa, you had your hand up previously.
I did, but I decided to put my question in the chat. You can read my question from the chat to save time.
Okay. Scrolling through, there's been a lot of.
I have it, Robin. Lisa,
Okay.
what is being done to increase access Oh, I'm sorry. My chat just jumped. Sorry. So what is being done to increase access to the self-determination program for African Americans who are over 55 and who have cerebral palsy? Katie, Dempsey, did you want to take that one?
I'm happy to take that. Lisa, thanks so much for, looking at that point, because there is certainly a disparity there. Joint efforts all around, Lisa, on many different groups, not just African American over 55, but we see these very specific groups of people. And so, I think we collectively look at that and say, how are we getting information out in ways that make sense? How are we making sure that the information that we're providing is appropriate for all of them? So, one of Katie's big dream goal that I'll share with you is more accessible information, having things like a participant handbook or a guide for people that's really broken down, and then coming through with that lens of making sure things are culturally appropriate, making sure people understand them, and maybe there's some targeted outreach to do to that, and then at that local level too, right? I'm looking forward to breaking down the data more and more and more, because are there certain communities where we can partner with our LVACs to get into the community and do that outreach effort in a way that feels appropriate for that community. So lots of work for all of us to do, I'd say, Lisa. But I think what's most important is that as we're doing the work, that we're coming from a lens that keeps culture in mind, keeps preferences in mind. And when I say culture, that's beyond ethnicity or language. It's age.
It includes everything.
Yeah, absolutely, Lisa. So please, if you have thoughts and ideas you want to share, door is open.
Thank you. Next is Kavita and David.
David.
Go ahead, David.
Yeah. I was thinking we need to have more people with disabilities in these different positions. For example, you might want to have somebody with a disability and a real severe disability with the ombudsman office, for example. We need to have more people with disabilities in the program.
Was your question, David? Can I echo your question?
It wasn't a question. David was making a comment, a suggestion to the department with regard to having more people with lived or living experience as part of the system, especially in the ombudsperson office, and also as SSDAC chairs, co-chairs, whatever. He feels that there needs to be cultural humility with regard to disability as a culture. And he feels that, the fear of retaliation is not necessarily something that somebody is doing, but the fact that they might lose existing services because people don't get what they're asking for. So he feels that somebody with a severe disability or somebody who is entirely reliant on paid supports or support from the system is somebody who is more akin or likely to understand the situation of individuals with disabilities. Did I accurately summarize it?
Yeah.
Okay, thank you. But that was David's comment. Go ahead.
Yeah, and so David, I think we've been like channeling the same brain because we have actually posted 2 positions in ombuds and 1 in policy for people with lived experience, to help us with outreach, to help us, work with our families and our callers. And so, we were thinking the same thing you were, David, that's something that we need.
Because I've been over 20 years of experience, and I'm willing to help in any way I can.
So he said he brings over 20 years of experience and he can help in any way he can. So thank you, David. I guess he will connect with you offline, Katie, and both the Katies. But I just had a quick remark, a question that I wanted to ask. With regard to the data that you're tracking, are we tracking data on individuals who are in supported living without bigger natural circles of support, who are entirely reliant on paid teams, and also people who are in residential settings? When I talk about residential, I'm talking about adult residential facilities, as to how many of them are aware to be able to access the self-determination program. We as a SSDAC at SARC had requested for this data to be calculated or to be collected, but we don't see any uptick in terms of people who are entirely reliant on paid staff or who are in supported living or congregate settings. We don't see any movement there in terms of them moving into self-determination. So I just wanted to see if the department can look at it, because as a parent, I know now that my daughter is in self-determination, but eventually I don't know where she's going to be when I'm no longer here. So that's something that we want to kind of see how are they going to be supported in the future. So just wanted to request if that can be tracked. Thank you.
Yeah. Thanks, Kavita. I'll respond to Kavita's, and then I want to get back and just share something else about David's comment as well. We could certainly look at a residence code, and they're changing some of the data fields that regional centers collect to enhance that. So one thing that's exciting is that we did just bring on a research person to our team who can really dive in and is dedicated to creating analyzing the data on a more granular level, and has the experience to be able to do those things and dig in more. So we're very excited about that. So let me see what I can work around, what we have, what we need. If we don't have it, maybe there are opportunities for us to enhance data fields further. But yeah, let's see what we can do on that. And then David, piggybacking off of what Katie shared, we are very excited. We have a new person that will be starting fairly shortly with us in that position. But I will also share, and I'm getting ahead of myself a little bit, so here we are. But I will share that we will be releasing some information about a participant experience focus group, mostly facilitated by members of our team, one of the new members that we'll be bringing on, and another member that many of you know that receive services in the program. And the intention there is to create that space to talk about the program, what's happening, what we can improve, but in a space that feels comfortable, non-judgmental, and gives people that opportunity to share freely without that fear of retaliation. So more to come on that, but we're really looking forward to a participant experience focus group, which we envision is going to drive our work forward.
Thank you, Katie. So on the list next, I have Celine, Judy Mark, Jamie, Christiana, then I have Lila and Alonzo. So Celine, you are a member of the public, so I'm going to go ahead and allow you to speak now. You should be able to ask your question.
Perdón, no tenía una pregunta. Mi mano la puse en equivocación. ¿Escuchó, intérprete?
Can
Disculpe.
the, sorry. I'm asking, are you guys hearing this translated into English?
I did.
Yes.
You did?
I
Okay.
did not.
Okay, so if you could select your language, then you should be able to hear the translation.
Select my language. Where?
So click on more.
Yeah.
Several dots will pop up.
No.
I'm sorry.
Interpretation?
Yes. And select English.
Okay.
And Robin, while I have you, could you remind those with questions to limit the question to 1 minute? Since we are now running behind our pre-planned schedule, which we always do.
Yes. Yes. Are you able to answer Celine's question? I did not get the English interpretation, so I apologize.
Oh, I heard her. She didn't have a
Okay.
question. She just rose her hand by accident.
Oh, okay.
I've been there.
I've been there too. Okay, next is Judy Mark. Judy, one moment. You should be allowed to ask your question now.
Hi, Katie and Marlene. This is Judy Mark, President of Disability Voices United and parent of a self-determination program participant. I would love for you each to spend 30 seconds or 1 minute answering the following question. What is your greatest concern about the self-determination program and its future?
Be honest. I can go first, Katie. So I don't want to say it's hard to narrow it down to one, but it is. And that's not because there are so many problems. It's just because I'm sort of a perfectionist. I think as of this moment, sitting here today, our FMSs are my biggest concern. And part of that is because it is so directly impacting people. Like when people call me and say, my respite provider hasn't been paid, she's not going to come to work tomorrow, which I don't, if I don't get paid, I don't go to work either. But like that impacts people immediately and dramatically. And so I think the FMSs, and I think the problem with the FMSs has a lot of facets to it. There's not one solution that could just fix it. If there was, we would have done it, you know? So that I'm going to say FMSs, Judy.
I'll piggyback off of Katie because mine relates to FMSs as well. You know, I think for me it is FMSs and the system that we work with in California labor laws right now is so complex. The protections that we need to provide our participants as employers of record, the education that we need to do around labor laws, the enforcement side that needs to happen on the FMSs to protect them as well. There's so many complexities to it. That's one of the pieces of all of it, but that's the piece that is making me really, really hyper focused on a lot of the work that we're doing with the standards right now. That's my biggest fear. That's what's on my mind. Marlene.
Well, you have great answers, so I won't use the same thing, but it goes alongside the same thing with FMSs, but also like knowledge and being able to put just more information in the hands of like individuals, families. At the end of the day, we see, you know, the different ethnicities, different populations. And I think a lot of the questions are like, how can this particular group of people, right, learn a little bit more about self-determination and have that option? So in addition to the FMS stuff that both Katies shared, I would say also just the knowledge information that is out there in order for people to just make more informed decisions, to be able to have more people with knowledge so they feel comfortable making that informed decision. So that's my answer.
Thank you for that great question, Judy. I really appreciate it. It paused me for a moment, so thank you.
And I'll also put in a plug that I'm surprised Judy didn't put in is Marlene will be on the SDP Connect call next week on the 11th. So everyone can get to know her a little better in that forum.
Yeah, absolutely.
Robin, who's next?
Sorry, I was muted. Next is Jamie. Jamie, I am going to give you permission to talk. Just one moment. You should now be able to ask your question.
Hi, can you hear me?
Yes.
Okay, hi, I'm Jamie, and this is my first time with you guys here. I've been invited when you all are in the Bay Area with Sheridan Nicola, and I just wanted to ask, actually it's more like a feedback for the town hall meeting, you know, the information gathering. I'm not sure if this would be a right platform to give some feedback, or do you think I should talk to someone afterwards, because there are some areas of concern I'd like to bring to the community here.
Oh, if you have some comments that are not related to the DDS report that was just given, then I could keep your name on the list, and when we open it up for public comment in just a little while, you could share that information. We just ask that you would keep it to 2 minutes. Is that okay? Can we circle back to you?
I just, it's actually regarding what we are doing here, but yeah, because like I say, this is my first time. I do not want to take up another person's time unnecessarily, but there are some concerns that I like to be able to address, because I'm also a person with disability, actually multitude disabilities, and I hope to be heard as well, because I don't seem to be able to get myself in the queue until now. Thank you.
Okay, I could also send you a message. Are you comfortable communicating in the chat?
I'd like to bring attention to everyone, but I don't know if there's a chance I can do that. You know,
no, you can.
Yes, thank you.
You're welcome. We'll come back to you, Jamie.
Thank you.
Next is Christiana.
Hi. On your chart where you were talking about, you know, the things that you're working on, your priorities that you're working on right now, one of the ones, and it was from the last information that was given by the state council feedback, which I thought was so great, was the delayed and missed payments. And I think this is a really, really important area, and one of those priorities where we're seeing late payments, and that's making people lose providers. They're unable. And a lot of that comes from the inability to move money within their spending plan. They have money available, but they can't move it around in their spending plan. It's taking weeks and weeks for the regional centers to be able to move this. So the flexibility to move that money, and because I don't like to make a complaint without a solution, my recommended solution is creating the 3 POSs for the 3 budget categories so you could seamlessly move that money around. And I think that would really help with those delayed and missed payments, as well as delayed rollover years, because we're seeing where people are literally running out, and they are having to call the ombudsperson's office and say, we don't have POSs, we need help. So that was just my comment on what you're working on and adding to it, and thank you.
Thanks, Christiana. And yes, those are all pieces of 2025 and projects moving forward that we're really hoping to dig into. To kind of give you a little preview into some of the work that we're hoping to accomplish, like easier to navigate spending plans and more flexible, standardizing them so that they can really be a universal, accessible tool for everybody. talking through, authorizations or what are our big dreams. I think we've worked through a lot of kinks in the program, but I think right now we're at this place where we can have conversations about what are our big picture outside the box ways that we can make continued improvements. So looking forward to hearing a lot of the solution things that come forward today.
Thank you, Katie. Next, I have Lila. Lila, you should be able to ask your question now.
Hello, do you hear me?
Yes,
Hello, my name is Lilia,
Lilia, thank you.
and I ask about DCI software, which is new to my vendors to submit invoices, and I have trouble with them because it's something new that my my vendors have to submit through the portal, and now we had problem because we submitted when we submitted on October 5th invoices for September. My invoices were rejected by DCI and FMS accepted and paid. And FMS sent me automatic messages. Every time when you submit, even if you submit next month on November 5th, you can submit only through us if you submit on the 5th of the month before 5 p.m. You don't have to submit through DCI. But then it contradicts what DCI tells me, no, right now you have to submit only through us. And I did. Second problem was I had trouble with the late consultant I had there. I don't want to complain, but just like they wanted to go back to rejected invoices and insisted me to resubmit them, and I can't convince them that no, it was already paid. So it's kind of communication problem with that DCI, and I want to continue submitting through FMS Plus through DCI at the same time because I don't know who is in charge of that invoices. That's very hard. It's new for me. I don't know why DCI software popped up in my vendor's life. It's kind of not helping.
Thank you, Lila. I'm not sure, Katie, if you have an answer. It seems very specific to this case. Did you want us to just wrap that into our report of an example of a continuing FMS problem?
Maybe it's not
Excuse me, this is Debbie Height. Lilia is on our subcommittee and we can't figure out how to help her.
Why?
Yeah, this is Marlene. So I think one of the things that you can do is go ahead and reach out to our office, and then we can definitely talk about the individual concerns to see how we can help.
Should I call ombudsperson Katie Honda?
Yeah.
Thank you. Thank you.
Yes, thank you so much.
Thanks, Marlene. And I think that's the correct answer. That's precisely what your office is for.
Yes, exactly. Yes, this is a perfect example of we want to make sure we support that individual concern.
Thank you. Next, I have Alonso. And if, like Rick said, you could keep your comments to 1 minute. We do want to pivot over into the main event in the next 5 minutes or so. Alonso, you should be allowed to talk.
Thank you. Can you hear me?
Yes.
Ms. Dempsey, one of the slides that you presented were enrollment numbers. And just to clarify, when you say enrollment numbers, are those individuals that were onboarded already with an FMS, or are those individuals that have been enrolled in self-determination, but they still have to go through the process?
That's a great question. And I'm going to give you a little bit of a technical answer here, but hope to kind of help you understand what it is. Those are based on people who have, we call it S type. super jargony, but what it is a change in service delivery type. So there's something that tracks when somebody is traditional services, and that first date that they receive their services and self-determination program, they should be onboarded with their FMS, their spending plans done. That is the date that they would be considered enrolled. We are now starting to capture and look at enrollment, the enrollment period. So from when somebody starts at orientation all the way through that change in service delivery type, we're going to start pulling into that data now, as we've just started collecting it from regional centers. But that is the point in time moving forward, where people are in the self-determination program with their FMS, their IPP, their spending plan, and it's that period where we often refer to it as service delivery type, but it's the switch that happens, and those that are in the program at that time.
Thank you. And I had another question in regards to data, because data really guides our work, right? This is kind of, it's sort of, it's a beacon, right? So my question is, in regards to data, is there any current data that you might be able to share that would demonstrate the number of people that have expressed interest in self-determination? They might have started a certain part, but maybe they were overwhelmed, maybe they lost interest, maybe they changed their minds, and then they just didn't follow through. Because it is such a lengthy, being a parent and having gone through self-determination from beginning to end, it took me 12 months. You really have to be tenacious. You have to have a certain level. You have to know how to pivot, because you'll hit a lot of road bumps. And so this leads me to my next comment in regards to when you broke down the demographic data, and when I was looking at the Latino or the Hispanic component, I think that's why we don't have enough Latino Hispanic parents. Because, having a parent with a disabled child, you already have so much on your plate. And this process is it doesn't seem very consumer friendly, because there's just so much that you have to do. So, I mean, if I were king for a day, right? I mean, I would definitely make the process a lot simpler, but I'm not. But also something that I've been asking for our regional center is, with our vendors, the independent facilitators, could there be feedback from consumers? Because when we're looking at certain vendors, when we're looking for certain services, sort of like a Yelp, like this independent facilitator was just amazing. They can walk on water. And then this one, oh my goodness, just avoid them, right? But, there doesn't seem to be any data to also help or inform the consumer, because it is so challenging to find independent facilitators. Some of them don't respond to emails or messages. And it's like, it'd be wonderful so parents or consumers can say, this one has really great reviews, or this one, because it also helps. Part of the recertification, I think it was one of your first slides, when you're looking at those recommendations or standards, I believe that independent facilitators, there has to be feedback from the consumer in order for them to recertify. Yeah. I think it's important to have consumer feedback in order for their recertification. So, do they respond on timely? Did they address your request? I mean, something to that nature all across the board. Thank you so much.
Thank you so much I'm jotting a million notes right here. Just appreciate you bringing the solutions forward and the emphasis on data. We're really excited about, again, being able to dig in, just pulling a couple things that you had mentioned. The first data point that we have currently, that doesn't mean we can't evaluate it down the road, doesn't quite hit interest, but it's that orientation. So there's that actionable period of time where it's consistent and we know, okay, this is that first step, which is taking orientation. Now that we have the data that tracks certain points through enrollment, we're excited to be able to even look at it through other cross lens. So can we look to see what does enrollment look like at this regional center? What does enrollment look like for people who speak this language? What does enrollment look like by ethnicity? So we're really looking forward as our numbers continue to grow for interest and attendance and orientation. We're going to be having some really valuable dive into that data to have more information and have targeted outreach around that. But I hear the ask for more data, and maybe next time we come, we can bring some fresh, maybe some fresh perspectives of our data as we dig into it, and just capturing your recommendations as well. So thanks for sharing.
So thank you very much, Katie. So Rick, there's a couple of things we could do. There were more hands raised. We have 17 questions in the Q&A. Most of them are for DDS. We've been answering the ones that are more generic. I'm wondering if on the list I have Barbara Pease and Janet Astat. I'm probably mispronouncing that. And then I thought I saw, yeah, and then there's several more people with questions. If you'd like, we can ask them to put their questions in the Q&A. And if DDS is able to stay a little longer and answer some of those questions in the Q&A, we'll absolutely collect them and they'll go out as part of the report that we're putting together for DDS. Or would you like to extend this agenda item?
Yeah, thank you, Robin. I seem to be not just the co-chair, but the timekeeper, which I don't do very well. So here's what I'd like to do, everybody. We want everybody to have the opportunity to provide a comment. I'd like to see those who have specific questions for either of the Katies to put them into the Q&A. This is going to run another hour and 20 minutes. I want to get to the main event. I also want to keep track of those who've already raised their hands, but I really want to move to public comment because it is the day. This is the day for the public to express their views. And so, Robin, I appreciate your comment. I concur with it. And what I'd like to do is close out this portion and move to the next portion and hope that people will not be offended by it because there's a lot of information yet to impart from people, by people and to people who are actually on the ground. But before I do that, I want to say this, Katie, I really appreciate, first of all, you providing the data in advance and for you coming today and for you responding to the questions. I think it's really important for people who are out there who are participating on this to hear from the department, and this is the opportunity for that direct exchange. And I find it to be very valuable, in fact, necessary. Thanks again for doing that. And then finally, Katie Hornberger, gee, I think you and I go back quite a long way because you were there from the beginning, along about 2013 or 14, and in a variety of capacities, you answered the call when it was put out for a person to head up the Ombuds office. And I want to, congratulate you for, first of all, finding Marlene, and second, wishing you the best in whatever your next endeavor is going to be. I have found you to be a really important ally over the years, and I appreciate your coming and certainly all the things that you've done over the last 9 or 10 or 11 years now.
Thank you, Rick. I believe in STP and I want it to work well because I think it can be great for folks. So it's really it is a treat for me to be able to be involved in making it great.
Yeah, thanks again. All right, we're going to move. It's always hard for me to cut people off, but we're going to move to the last item on the agenda, which we always call the main event night. Whoever's working the slides, I wonder if you could put up my slides are not numbered, but the one that says examples of the program working hour stories, and then flip to one page after that. One more page. There you go. All right, everybody, this is why we're here today. You're gonna tell us and the world what's on your mind. And I want to remind people that as we begin, we are going to put up the principles because we are hoping that you can relate your comments or your questions to whomever they are directed to one or more of the principles of self-determination. But as you guys know, we're always pressed for time, and I'm going to end this at 1:30. It's going to happen. So I'd like to have you keep your comments or questions to 2 minutes. We're going to make you do that. Now, I don't have control of the mic, so I can't cut you off, but I'm going to really hope that we are able to keep the comments to 2 minutes. Second, if you wish to speak, raise your hand, and Robin and Beth will monitor that and bring people along. And then once again, the Q&A will be open throughout the meeting. If you've got a question or if you've got something that you want to say, we have a Q&A, we have a chat, and all of this is going to be included in the information and comment that is presented to the department after the full committee is able to review it, to analyze it after it is synthesized by staff, and that will happen, of course, early next year, and it will happen during a public meeting as well, our next meeting. So with that, if I could go back a slide, because I want to kind of kick off what it is that we're kind of provide an example of what it is that we're going to do. Let's see if I can do this in 2 minutes. I have two things that I want to say. One, for those regional centers that have initiated an SDP unit, my impression, including that of my own regional center, which is Kern, is that it has really promoted and accelerated the pace of enrollment of SDP or in SDP. I put that out there in 30 seconds because it is really worth examining the 4 or 5 or 6 regional centers that have actually established units. We see momentum, we see passion, we see commitment, and we also see a smaller group of individuals who need to know a lot of stuff in order to get people through. And I'm hoping that will work. It's certainly beginning to work for our regional center. And so the second thing is this: if we could go, if you could put up the person handling the slide, the last slide entitled Guiding Questions. There it is. Okay, let's keep that up. So here's my example, right, of a comment that relates to a principle. And that is, it's really a combination of freedom and authority. I've thought a lot about this over the last couple of weeks. There's a whole bunch of stuff I could say, but I'm going to say this. If you think about it, what self-determination, if it doesn't accomplish anything other than this, if you think about it, people want to be able to choose what services and supports are best for them, provided that they fit within their IPP, right? That they address goals that are set forth in the IPP, and provided that they are allowed by the federal waiver, which prescribes what the services and supports are that can be supported by self-determination. It can be very, very simple about choosing one brand over another, or it can be very simple, which is choosing a service that is provided by a vendor, that's not provided by a vendor, as opposed to in the traditional delivery model is provided by a vendor. In other words, if the regional center has a vendor that provides a service that can be provided by some other non-vendorized entity that you wish to engage or employ, if that's the only change in your life, right, it gives you the opportunity, that is, SDP gives you the opportunity to make a choice. And you have authority over the things that are important to you to achieve your best life. So I'm deliberately not specific. Here's the caveat, and then I'll finish. The caveat is that is only as good as your FMS. You could see the Ombuds chart that shows that the most complaints are about FMS. It relates to communication. It relates to timely payment. It relates to transitioning. It relates to everything that is most important, which is to make sure that the money is there to purchase the stuff and hire the people that are necessary for you. So for me, it gets back to the FMS. The goals are great. The self-determination program provides a lot of opportunity, but if the FMS is in the way, you need a new FMS. So there's my example. I'd like to turn it over to Nestor. Nestor, if you have something that you would either wish to type or wish to say as an example to kick this off, and then we'll hear from members of the public.
I'll just read what I typed, but it's going to be with the support principle. Okay. The support principles of self-determination are important to me because I had received services to help with social skills, and it only helped me out to a certain extent until self-determination. Self-determination allows me to be more hands-on with my services and does not limit me to services in a specific area. If I cannot find what I need around me, I can find it somewhere else. I am making real progress in finding career paths, socializing, making friends, and discovering myself with the services I could get with self-determination. I wish I was in self-determination when I was in high school or college because I could have maximized my opportunities then. But even receiving it now, like it's helping me out tremendously with the limited opportunities I have right now that are growing. Even without like not a lot of people my age to like hang around with, I'm still getting a lot out of self-determination. The problem right now is like it's kind of bureaucratic with the FMS, but like that's being worked on and it gives me opportunities I would not have in the traditional system. Thanks.
Nestor, thanks. And wow, I'm impressed by the interpreter trying to keep up with the pace.
Well, I have it written in the chat if that helps.
That actually reminds me, which is that we've actually cataloged a couple of successes, right, or positives, and frankly, those positives are going to be matched, if you will, by barriers and negatives. I'd love to hear solutions. So, Robin, I will turn it over to you.
Thank you, Rick. If it would be okay with you and Nestor, I'd like to circle back and kick it off with the lady Jamie, who patiently waited for the DDS questions to finish because she had general comments that she wanted to make. And then after that, Beth and I will just go through the list and we could do it. We can take one from a committee member, one from a public member, however you'd like to do it. Jamie, if you are still here, I'm going to allow you to speak. You should be able to go ahead and ask your questions or provide your comments.
Thank you. I'm still here. I appreciate the opportunity. And I want to bring a feedback to SDDC because, a lot of what is actually being established is actually pretty much a way like a generic form. I'm concerned about people who have cultural and linguistic barriers. A disability doesn't limit you to your race or your intersectionality. So a lot of times when you have works that support the community, I just want to suggest to the community here to think about people who have, disabilities that are visible and invisible. And, being a student, how is stigmatizing it is having a multitude of disabilities, and there's not much of a way to support when, if for myself, I can speak English, but there are some of us who don't have the means because their first language is not English. And being, the subculture in the culture as a norm is always being able, not being adhered, because, you want to put a one way that's standardized. But standardized means that you don't give other people who have different backgrounds, there's no cultural sensitivity or humility to understand what the challenges would be. For example, like learning disability or discombination. When I asked for help in my college, they told me this is the only way they have. And I don't understand, because my disability is not like that. I have low vision, or I don't have the disability of like what is stated there. Does that mean I have to suffer in silence? Or does that mean that, I keep on advocating, but it feels like I'm barking on the same tree, but it's always being shut down. Nobody hears me when I try to attempt, like to say that I have a post-concussion and now I have a severe kind of disability. How do I tell you when some days are not really helping me? Like my eyesight is slowly going, my hearing is going, and there's a lot of things I'm actually impaired with, besides my physical and mental PTSD I've gone through an accident. So there are issues that are for people who, who come in because we have to suck up to the system, I'm sorry to say, because we need the help. But what if the help is not appropriate and it doesn't really cater for those who really have, representations of the disability that's not mentioned? I know this is for developmental disabilities, but I'm just saying that, like, for example, does that include people who actually later part of the years when they actually develop this disability because of the concussion or something else? Does that have that kind of representation as well? And there's so many other subcategories. It's especially around the racial and ethnic disparities. I'm talking about racial disparities and some social disparities. The basic means is the accessibility. There's nothing that equate to the component to help that person enunciate their struggles. And I'm going to keep it short because I know there's a lot of people on board. But can someone call me back and discuss with me? I like to be able to understand so that I can be a better representation, especially for those in the North Bay. I know we have this new lady who actually working with the Orange County as an ombudsman. But how about us in there? There are a lot of intersectionalities that need to be represented as well. Thank you.
Jamie, I'm going to go ahead and put my email in the chat, and for accessibility and the things, we want to make your experience at SSDAC as inclusive as possible. So regarding that piece, you could contact me. And then Mr. Co-Chair, I don't know if you had any comments you wanted to make.
Can I leave my email as well, please? Would I be able to leave my email?
Sure,
and,
sure.
So that we can have a Zoom conversation, at least so to be able to dive a little bit deeper so you understand the holistic of things. Thank you.
Sure.
Appreciate it.
No, I don't have a comment other than I'm going to constantly remind people to try to keep, not to try, they need to keep their comments to 2 minutes. There's a lot to say, but we can't take, honestly, guys, we can't take 5 minutes each, even though you need 5 minutes. I know this. We need to condense this because we want to hear from everybody. And as you will see at the end, all this feedback is going to be compiled and synthesized, and we're going to create recommendations. So if you could relate your comments to a principal, if you can then make a recommendation for change or fixing something that you think needs to be fixed, that would be appreciated. Robin, go ahead.
Thank you. Next, I have Jane Allstat. You should be able to ask your question now.
I'm sorry, I didn't have questions, but I wanted just to say that thank you very much for the job you are doing. It's amazing, and we started like self-determination. We started enrolling into this program, and yes, there's some bumps, a lot of nuances, but yes, it's just amazing program, and thank you very much.
Thank you, Jane. Next, I have, sorry about that. Next, I have Joyce Butts. Joyce, you should be allowed to ask your question now.
Okay, now we're on.
Yes.
Okay, good. No, I echo that woman's comment too. I do appreciate SDP. There had been times when I would be frustrated and saying, "Oh, maybe it'd just be better to go back to the regular POS." But a lot does depend on the independent facilitator and the FMS. And I did record one of the things in the Q&A, but I didn't know when I would get an answer on that. And one of my concerns is with the FMS, if there's ever anything legally moving forward that would allow the parent or legal guardian, who I am of my daughter, to get reimbursed for goods. And the example I used was like orthopedic shoes, because Medicare or insurance doesn't cover it, but it's something that's required, and the regional center has approved it. But you have to like onboard these vendors when it's kind of like a thing where maybe every 6 months you're going to be accessing that service. So do they have to go through all that onboarding, or is there, I can see there's probably a lot of caveats to allowing that. Then the other thing is how would I access, like you mentioned, that training in hiring staff and so forth, because I'm pretty wimpy when it comes to that. We are in a co-employer arrangement, but so that takes care of that legal part, but it's just the interviews and so forth. I was intrigued by that piece that you had in an orientation piece, and was just wondering how to access that. But really appreciate everybody's efforts. My daughter has an incredible at-home program going on now on Zoom that would, she's finally learning how to read at 40 years old. And that's so important, from a safety standpoint. So I do appreciate it. Thank you.
Thank you, Joyce. Next, I have Barbara Pease. Barbara, you should be able to ask your question or provide your comment at this time.
Oh, thank you very much. I'm sorry my hand has been going up and down. I just haven't been knowing quite when I should talk or should ask to talk. My comment question is kind of in the realm of the support and responsibility. And also it is about the FMS and standards and customer service expectations. The specific incident was that when my son's budget, the new budget renewal happened, for some reason, the FMS did not input it into their system. And this was, totally not mentioned, nothing happened. One of his providers is sort of a special deal, pays 6 months in advance. And that was out of last year's budget, which is kind of coming due now. But the first that we realized was when one of his providers submitted an invoice. It was submitted in October, and about 3 or 4 weeks later, I get an email saying that my son has no budget. I have a wonderful IF, and thank you very much, Keyshawn. And he's a client of San Andreas of SARC, and the team worked very hard. the FMS has apologized and reinstated the budget, but I just want to know how this can be incorporated, more transparency. This shouldn't have happened in the first place, but how can this be prevented or at least seen in the future? And that's my comment.
Thank you very much, Barbara. Next, I have, just let me lower your hand. Next, I have Sandra. Sandra, you should be allowed to provide your question, ask your question or provide your comment at this time.
Yes, well, I have some solutions to offer. I have friends in Minnesota who are in self-directed services, and to move money on the spending plan, they log into the computer, and this is already existing things. And give you an example, they may move $1,000 from personal training to staff or vice versa. I can see, needing a spending plan approved when it's a revision and you're adding completely new services. But when you just need to move money from swimming lessons to staff or something like that, and these things are already in there, this should not have to go through all the bureaucracy that we have right now. There should be a simple way to move those funds without going through all of that. The other thing is, one new FMS is providing prepaid debit cards for gym membership and other services that won't be vendored or can't be vendored. That is a brilliant solution. The prepaid debit cards can be set up where the only place they can be used is for the name of the company that they're going to be used for. I actually use that for my son, so he has a limit of $50 a month on Apple, or he ends up with $3,000 worth of apps. Then speaking of freedom, Marlene, welcome. And Marlene knows this firsthand. Regional Center of Orange County micromanages the spending plans to the most ridiculous point. If somebody has staffing hours, they have to be used for staffing hours. If somebody has funds for a gym membership, they have to be used for a gym membership. It is completely removes the freedom aspect of self-determination. And I've asked the Ombudsperson Office to address this in the past. Then we have GT Independents who's micromanaging, and they're micromanaging differently. So it's almost impossible to get a spending plan that Regional Center of Orange County and GT Independents both agree on. And then finally, the FMS agencies are not allowing clients to start their new year until they have the fully authorized POS, which sometimes can be, the 15th of the month. So I have clients whose staff can't clock in. They can't pay any of their vendors. They can't do anything until the FMS has received the fully authorized POS authorization. So somehow that needs to be addressed, that those be put in place sooner, or that the FMS accepts the POS authorizations before they're fully authorized. Thank you.
Excellent. Thank you, Sandra.
Thank you. Next, I have Tanya. Tanya, you should be allowed to ask your question or provide your comment.
Hola, buenas tardes a todos. Sí, mi comentario es acerca de las recomendaciones que ellos habían puesto para el FMS. Yo creo que los FMS y los centros regionales no necesitan recomendaciones, necesitan guías, necesitan saber cómo hacer las cosas, porque al final de cuentas, con una recomendación, pues no hacen lo que quieren y dejan a las familias al aire. También quiero hacer el comentario muy rápido. Hay algunos centros regionales que nos están limitando en cuanto a cuánto tiempo se debe de hacer la junta de IPP. Es decir, yo que tengo en el programa a mis dos hijas desde el 2021, sé que lleva tiempo hacer el plan de gastos y todo eso. Entonces yo con mi facilitador independiente me quiero preparar 3 meses antes, pido la junta 3 meses antes y mi centro regional me responde, lo más pronto que podemos hacer la junta es un mes antes. Entonces, para cuando yo obtengo la junta, ¿qué es lo que pasa? Y hago el plan de gastos, lo mando al centro regional, el centro regional lo aprueba y lo mando al FMS. Mis hijas están entrando 4 o 5 meses después de la fecha programada. Acudo a la oficina de ombudsman y a veces la verdad, con todo respeto, a veces la verdad no me ayudan. Entonces, pues sí quisiera que por favor hubiera más ayuda en cuanto a eso, porque hay muchos, estoy viendo las gráficas y solamente entraron como 17 personas en este año autodeterminación. Entonces no sé por qué se están tomando tanto tiempo y nos limita el centro regional en hacer las juntas en tan limitado tiempo. Gracias.
Thank you, Tanya. Next, I have Judy Mark. Judy, you should be allowed to ask your question or provide your comment.
Great. Hi, everybody again. I decided to delay putting my hand up because I thought there was a lot more people in line and I just put it up. So hopefully more people will speak after me. So I wanted to just bring to the SSDAC's attention what is happening at the master plan, because I think it's really important for folks to know that the self-determination program is going to be a key part of the discussion at the master plan meeting, which is next week on the 11th of December. It's fully virtual. And work group 1, which I sit on, is going to be talking primarily about the self-determination program at that meeting. And so I can tell you the recommendations that at least I am trying to put forth that day, and would encourage everyone to participate during the public comment, as well as you're going to be in small work groups. But we are recommending that the self-determination program become the core of the developmental services system. And the way we are saying that is, number one, to break down the barriers first, that we have to break down the barriers, or else there's no way we can expect large numbers to come in. And the target that we have for that is the bill that my organization, Disability Voices United, as well as the State Council and others supported, called Senate Bill 1281, which was unanimously supported in the state legislature. The regional centers supported it, and yet Governor Newsom vetoed it. And we are asking the Department of Developmental Services to implement the provisions of that bill. In the governor's veto message, she specifically said that the master plan should be taking up this issue. And so we are trying to get a set of recommendations to implement those provisions of the bill without having to pass more legislation to do it. The second piece is we want to ensure that every single consumer of every regional center knows about the self-determination program. Right now, I would guess the vast majority of consumers have never even heard of the program. So how are you going to increase the numbers and make it the core of the system if nobody knows about it? And then the third piece is for us to develop some pilot programs within specific regional centers to dramatically increase the numbers in the SDP. And those pilot ideas could include focusing on a particular ethnic group, such as Latinos, who are terribly underrepresented in the program, and bringing them in with incredible support, or targeting people with no or low purchase of service dollars, or every new consumer that comes in automatically goes into the SDP and never even knows what the traditional system is like. So these are the ideas that we are floating on the master plan, and hoping that people who serve on the SSDAC and on the other volunteer advisory committees will support us in this and bring your own ideas so that we can really expand the self-determination program, but first break down the barriers. Thanks.
Thank you, Judy. Next, I have Valerie, and then Yasmin, and then we could pivot over. There's several questions from or several hands raised for members as well. Valerie, you should be allowed to provide your comment or ask your question at this time.
I just wanted to ask why the FMSs aren't allowed to reimburse payments anymore, and that's somewhat taking away freedom. There are situations where on road trips there are no other gas stations that I've been provided cards for, or when my service dog needs to go to the vet, yet the vet does not want to become an SDP vendor because that is a long and drawn out process. So it's just causing a lot of problems and taking away my freedom and choice. Thanks.
Thank you, Valerie. Next, I have Yasmin.
Hello, everybody. Good afternoon. My name is Yasmin, and I would like to share on behalf of my son. My son is a 25-year-old young man that has high needs, and I wanted to speak very favorable on the self-determination program that has really been a life changer for my son. He requires 2-to-1 supports. Before the self-determination program, he really didn't have the choice to receive that support at home. So that's been a huge life improvement for him, choice and freedom. I want to echo the young lady that spoke before me about the need to have perhaps more guidance or oversight over goods and services, so we do have accessibility to purchase some of these items. I will use an example. It is a hurdle to get even extra incontinence supplies. We just need to make it a little bit more accessible and a little bit more clear, where a participant it does have the option to have a unique card to purchase some of their some of their supplies, some of the things that need to be used. Like for my son, there are things that there are still many unmet needs, and which I want to speak to the second point. I feel like I want to speak to the fear of advocating and the fear of contradicting anything that comes from the regional center. We're here in the north, in Alta California Regional Center. My son is Latino. We're highly underrepresented. I myself have made a large attempt to participate in the regional center system to have my son's experience and voice be heard. And there's been, unfortunately, not a lot of I haven't felt the embrace. I haven't felt the cooperation, the collaboration, and which is really unfortunate. I want to speak to the fear of really retaliation, what it looks like for my son, and he's a non-speaker. So I really need to honor his experience and share with you that in his first year of self-determination, we went through at least 6 service coordinators. In his second year, there are some services that have been have not been funded, very significant and important services. We've gone through due process. We've gone through all of the barriers, and these are fundamental services that he needs. And there's been some challenges in processes in not collaborating with the self-determination program. And I will use this as an example. Regional Center is willing to pay for my son to go to a center that is contracted with the regional center, but very hesitant to provide the funding for a self-determination provider. So there are still some of these things, some of these indignities that we have to iron out. So I just wanted to bring this to your attention. We definitely need more life experiences. We need more representation of people like myself that will speak on behalf of my son, that have his best interests, that needs, my son is a 25-year-old man that is going to need significant support from the system, throughout his life. And we have experienced everything. Yeah.
Yasmin, can I have you wrap up your comment? I'm sorry.
Absolutely.
Almost at
Absolutely.
5
Let me go
minutes.
ahead. Absolutely. Thank you very much. There's just so much to say and so many.
Yes, of
And
course.
I just feel that on behalf of the Latino community, especially here in the North, I really thank you for giving me the extra time to share our experience, the areas that we need to grow on. And I'll just close with the need to have the representation, the voices. And I want to praise you all for even having this town hall and growing the program. I want to thank all of the efforts of every single person that's present here. So thank you so much, all. Thanks for the time.
Thank you, Yasmin. Okay, if it's okay with you, I would like to pivot over to members' hands that are raised. I do see that there are 2 more hands raised in the audience. However, there are a handful of members that have been waiting patiently. If that's okay with you, Rick?
Yes, it is.
Okay. And then Beth is sharing a 2-minute timer just for members of the public and committee members, just to help you guys stay on track. We know it's tough to stay on 2 minutes, but hopefully that'll help you. Christiana, would you like to go first?
Thank you. I want to start by saying my son is in his 4th year of self-determination program. It's been life-changing for him. It is. So I want to start with the positive. I want to talk about the authority part, and I want to kind of echo what we've already heard, which is we need DDS to clarify that the regional centers are requiring that things that are in their budget, the traditional services, are being matched in the spending plan, and that shouldn't be happening. And we're seeing it at multiple regional centers. And sometimes it's not even consistent within a single regional center. So there has to be additional training here. I also want to see a directive that talks about the regional centers trying to impose the POS standards on the spending plans. So while they can use those standards to create the budget, they are also trying to use those standards on service codes that are not in the traditional system. And finally, I want to talk about the directive on December 26, 2023, that talked about the FMS is needing to pay for local businesses in the manner that they are typically bill. Many of the FMSs are not doing that, and so I want to make sure that since this directive already exists, that DDS isn't going to enforce that directive. Thank you.
Thank you. Next is Chris Miller. Chris, you are on mute.
I thought I unmuted, sorry.
No.
So one of the things I've been hearing a lot of has to go with the principle of freedom, especially I think down in very Northern California where I am, where we are very rural and very distanced. IFs aren't being able to be paid for travel time to go and see people they might be supporting in rural areas or with some of their other time. And sometimes Zoom meetings and whatnot don't work for people because that's not how they operate. So I would like to see that IFs get reimbursed for their travel time and their face-to-face meetings that they have not been like, and mileage, they haven't been reimbursed for those things either. So I'd like to see those things changed so that people have more access to their IFs when needed. Thank you.
Thank you, Chris. Next, I have Kavita and David.
I know from, again, my own personal experiences, expertise, that a lot of these clients, especially the self-advocates, they don't give me that help.
So, David, we posted this comment on the chat. David wanted to ask what kind of recourse is available when self-advocate co-chairs or, when committee members are made to feel like their input is not valued by executive team members of the regional center, especially when they're raising systemic concerns and process issues. It reeks of lack of cultural humility, and especially with respect to people with lived experiences. So David wanted to know, how do we how do we make sure that that self-advocates who do open up and speak up about situations or bring problems to the SSDAC are not being disrespected or made to feel like they don't amount to anything so the words that he wanted me to use was, what was touted was the fact that there is a chain of command and people need to go through that chain of command to get their issues addressed.
But I know a lot of the advocates that are talking to me because they don't want to bring this up to them because they don't believe that they will be heard. That's why I brought it up to my regional center.
So
our director made me feel like I was too idiot.
So there are some self-advocates and families who brought it up to him because he's the co-chair of the SSDAC, and when he brought this issue up, the executive team or whoever, the executive director actually made him feel like, he didn't amount to anything, basically just completely dismissed the concern. So he wanted to know, how can SSDACs and also the executive teams of regional centers be held to a higher standard when it comes to being, culturally humble and culturally sensitive to individuals, especially those with lived experiences. That's David's comment. I do have a comment after that, but I just wanted to share that with you. Okay. Can I go ahead and speak, Robin?
Yeah.
Okay. Aside from this, I wanted to kind of echo what Christiana Morales said about the enforcement of traditional budget items in the spending plan. I put that comment in the chat as well. One of the biggest bureaucratic bottlenecks that we are finding in the self-determination program is that in the development of the budget phase, we are using still traditional models, and it's although there is a person-centered plan in place, there are not person-centric approaches being used to develop the budget. And if a budget is developed and a need is identified as being there for an individual, their needs that need to be met in SDP are restricted to those that some regional centers are deeming as certified under the traditional model or vendored. For example, a crisis management or crisis intervention agency in the traditional model is approved for the client and it's put into their budget, but the regional center wants to ensure that it is another crisis, the same crisis intervention agency, or one of the 2 or 3 different crisis models that not models, agencies that I used to be able to provide that service. That really is not choice, and that really is not freedom to be able to access a resource that would actually address the need of the individual. The same thing applies for behavioral respite and a few other factors. So that needs to be clarified either via a directive or via some kind of training to regional center SDP teams. And that was my comment. Thank you.
Thank you. Sorry, I was muted. I don't see any other members with their hands up. I'm going to go back to public members. Next, I have David Bloch. You should be allowed to speak and ask your comment or ask your question or provide your comment.
Hi, I just wanted to say, oh, let me turn on my camera. Oh, no option. Okay, I just wanted to say what an amazing job the self-determination program has been for my business, Block Care California. GT Independence and Regional Center, I just want to say thank you. Like, you know, it's a bumpy road. I've gone through the whole journey, and yet I still managed to make it on the other side, smiling. So what I wanted to address was that we needed like a better way for us to communicate and be on the same page about certain information, such as when we try to do the onboarding process, there may not be people who know the right information because they just weren't understanding the service codes. So how can we just work together to, you know, educate and be on the same page? And I wanted to address Yasmin. Shoot me a message. I'll leave it on the chat and I will make sure you feel heard, okay? I will help you out as best as I can.
Thank you, David. Next, I have Val. Val, you should be allowed to provide your comment or ask your question at this time. Oh, try it now, Val.
Unmute. Am I on unmute now?
We can hear you.
Great. I am an independent facilitator for my son, who is a 30-year-old on the spectrum, and he has been in self-determination. We're starting year 5, so he was in that pilot program, and we are still experiencing most of the same problems that you've already indicated regarding FMS, timing of payments, and all of those things. But what I think of as a secondary problem is the regional center seems to find these directives more aspirational than mandatory. And I'm wondering what plan is there to make it uniform with regard to when they have to be adopted and, you know, specifically a time frame in which they must adopt them, because we're getting pushback. I'll send a directive right to my son's service provider and say, you know, here's the directive. We'd like you to do X according to this directive. And sort of they have this sort of nonchalant attitude about, well, we'll kind of get to that, or I haven't seen that before, I'll consider it. So I'm wondering if there's any way to make it a little bit teethier so that things can be uniform. And then my other comment was about implementation, because I do think that there's an issue, you know, about you know, different ethnic groups, and why is it that certain groups are overrepresented and others underrepresented? And I'm wondering if there's a way with the use of the standardized IPP form, if there might be some language up front and even also on the signature page that says they're signing and they have to check a box that says they understand that they're opting either in or out of self-determination every time they go through an IPP, or perhaps right up front at the beginning, page 1 of the form, it says, you know, have you discussed with your regional center the SDP option as well as the traditional model? And if the answer is no, please request, and then maybe you guys have a pros and cons sheet that it has to be sent if the participant, a potential participant, is unaware of the SDP option. I'm running out of time, but thank you so much for letting me comment.
Thank you very much. Next, we have, is it Raji? You should be allowed to ask your question or provide your comment at this time.
Hello, this is Raji. Can you hear me?
Yes.
Okay, so this is I'm a parent and an IF for my daughter, and I echo everybody else's thoughts on especially on the traditional model as a baseline. Which even today, like after so many years of SDP being put in place, the case coordinators are not very familiar with how to actually bring uniqueness to the SDP program for their clients. It's so that's one. The more important point that I wanted to make today is about the timelines. When we send a request, maybe or ask for guidance and send our email to the SDP specialist team, oftentimes we don't even know whether they actually saw it or not. It's not acknowledged. We don't know how long it's going to take. Sometimes even if you put urgent on the subject line, it will still take a week or so for them to even get to it, because apparently we are in the queue but they have not looked at it, sort of. So is there a way that we can somehow either have more SDP specialists who can actually respond, or is there a triaging system where someone a little bit junior can actually look at the email and make sure that whether this is a priority email or not, and then accordingly respond? Because sometimes there are some FMS related budgetary issues. As someone had told about the POS issue. So yeah, I mean, sometimes those are very important. Our people are not paid on time, and so we have to really become very aware that these emails should be responded to in timely fashion. Thank you.
Thank you so much. I now have, I see a hand up by Kavita and David. Would you like to go ahead and ask your question or provide your comment at this time?
I have a comment, a suggestion to make. Based on what the co-chair Rick Wood shared that the STP departments at regional centers are actually contributing probably to the uptick in the numbers of participants transitioning into self-determination. I would like to make a suggestion to DDS and also to the SSDAC to carry back, is to provide a comprehensive training to the SDP departments. To develop something that's going to be a really robust and comprehensive training. When IFs can be held to a certain standard, so do there is a need for SDP specialists at the regional centers to be held to that standard as well. So it's really important that everybody speaking the same language and the same and are aware of the same practices and directives and everything, because your success in STP is limited to the success of the STP specialist in your regional center who's guiding you. So I would like to make that recommendation. The other recommendation that I definitely like to make is, as the co-founder of Pragna, CBO, it's really important to see if there could be a collaboration with community-based organizations who might be able to support families on a cultural level, and also self-advocates on a cultural level, to be able to provide that training to the CBO leaders as well, so that we're able to add value and support individuals who want to transition into self-determination through through programming that they can make available at the local level. So those are my two suggestions.
Thank you, Kavita. So Rick, Jennifer Walsh also put a question in there that we'll be sure to include. Is anyone advocating to change the rule about STP taking over the standing ETN? And then there are no other hands raised at this time. So I'm wondering, DDS, if we can go back to some of the written questions that are in the Q&A, and perhaps if you're able to answer them live, if that works for you.
And Robin, this is Rick. While they're thinking about that or thinking about responding, I've got a couple of suggestions as well.
Oh, please. Sorry, Mr. Chair, I should have asked you first.
No, I didn't put I was waiting for everyone else. I thought that Yasmin's comments were really good, including the comment with respect to kind of the mistrust, if you will, or fear that there might be retribution in the event that someone were to either register or lodge a complaint or raise an issue. And I just want to say that's what the Ombuds Office is for. I would hope that people who have issues would make contact with the Ombuds Office. Secondly, this whole issue that she raised as well, Yasmin did, about access to goods and services, this really goes to the question of advance pay. I would love to see a change. I don't know whether it can happen or not under the waiver, but I would love to see the opportunity for there to either be advance pay or something like a debit card for specific purposes that would allow people to make purchases in a certain amount. And the reason I say that is that in the original pilot, my son was in that pilot for 25 years, there was the opportunity for two things. One is advance pay to purchase stuff that you just can't go to a vendor and bill. People need the money in order to access the service or the good, and or reimbursement. And it seems to me that we had it. We had that in the pilot. And I think that there's this general thought that, oh my gosh, if you put public funds into the hands of people, that they're going to squander it, they're going to spend it, they're going to misuse it. I've seen that in the longstanding food stamp program for many, many, many decades, actually. And I think there's a bias against people who are receiving services, which is that there's kind of an assumption that they're going to take advantage of the system. So that's my comment on that. And then last but not least, so I think Judy Mark suggested that all consumers should know about self-determination. And this is something in my regional center that we have really focused on. Now, I may get the directive wrong, I hope not, but my understanding is that there are IPP changes that will be put into place for all regional centers beginning January 1, 2025, which requires there to be an acknowledgement by the participant or the family, the consumer or the family, that they have been advised of and received an explanation of what the self-determination program is all about. Kern Regional Center has committed to a comprehensive information program for each and every of its 14,000 participants, not participants, but consumers and families, to be completed by December 31st, 2025. So I'm encouraged by that. And as we know, that explanation can be very brief, it can be biased, it can be great, it can be all of those things in between. And the key, of course, is going to be to make that happen. And the way that Kern is going to make that happen is that its participant choice specialists, who are members of the SDP unit, are going to be present for all of those IPPs. So that they can ensure that the service coordinator is delivering the information in a way, as well as the terms or the actual substance, which will inform people so that they can consider making a choice. So those are my comments.
Thank you, Rick. Before we pivot over to see if there are any questions in the Q&A that we can address right now, is there anyone else who has any questions or comments? Public members, committee members?
And I see Val Montague in the attendees has raised their hand.
Okay.
Val, I'm going to go ahead and allow you to provide your comment or ask your question. You should be able to do that now.
Yes, just pivoting off of what was just mentioned, I do think that there's a lot of information that's subject to interpretation, and some of the presentations might be more compelling than others as far as letting people know what SDP is about. But why couldn't that all be avoided if we had uniform information in the form of, just a simple chart that says pros and cons of the SDP versus the traditional model, so that people were making an informed choice and that everybody had basically the same information. Now, you can still spin it in a negative or positive way if you're, or if you're at the meeting. But if we had a standardized piece of information, much like the IPP now being standardized, I think that's a step in the right direction. And if we had a little bit more uniformity, I think people would have to take notice of this, and the regional center staffs would have to make use of that information and provide it to each potential participant, because I think SDP is the way of the future, and I can't imagine anybody would want to be in the traditional model if they really knew what it was about and if we got through some of these glitches. That's my comment. Thank you so much.
Thank you. And I do think, I just want to pivot really quick to just make sure that there is one more hand raised. Oh, that was Val. And then there's two members. And then Katie does have some closing thoughts that she wants to share with you. And we are looking through those Q&A right now. I just want to let you guys know that. So Nicholas, would you like to go first?
Oh, I'm sorry. I see my name, my last name. It's Vivian. Thank you, everyone. I wanted to just, I saw, I think it was Kavita that made a comment about standardizing a spending plan template. So I want to definitely ditto and support that, especially since the regional centers are working on a uniform IPP template. So let's do the same for the spending plan. The reason why, and I'm also speaking as an IF, the reason why I think this helps also streamline and prevent barriers is because it will uh, further prevent delays in getting those changes implemented by having a consistent uniform spending plan that all, even regional centers and FMSs are required to use. There's
Yep.
some amazing ones that some regional centers are using, and there's some very non-practical ones that many regional centers are insisting on using, so that oftentimes there's two templates being used concurrently because the FMS has to have theirs, the regional center has to have
Yep.
theirs, causing more delays. So it would be great if we could also see a uniform template, and I'm happy to share those regional centers if anyone is interested that I think are pretty marvelous. But that would definitely help. And then I think also just finding, you know, and I don't know to what extent this can be enforced, but also having regional centers kind of be consistent with their timelines and response times to spending
Yep.
plan changes. We are now having to enforce some not within the last 60-day changes, only because there are regional centers out there that are taking at least 60 days to process a spending plan change, even though we've given them all the information they need and then some. It's just, it has to go through different chains of command and based on volume,
Yep.
etc. So this is causing a barrier because for those last minute changes that are quite urgent or unmet needs that do come up, it causes a major barrier in getting that done, and families are having to wait longer than usual. So those are just the two recommendations that I think pretty much apply to most, if not all, principals as well. Thank you.
Thank you very much. Kavita and David.
David.
Okay. From a person that's using this program, I think, and again, I love some aspects of this program I like, but there are other aspects of this program that make me wonder if it's even worth it. And Kavita can go into more examples for me.
So David is saying he's been in self-determination. This is he's going to be entering in March his third year in self-determination. It took a lot for him to get into self-determination, to make the decision to make that switch, because he's entirely reliant on paid supports. While it has been good for him to pursue his political aspirations and ambitions, getting out into the community and pursue, including his getting an internship, and being out into the community rather than the quality of life that he was relegated to with regard to being confined to his house and the bed most of the time. He feels that there are many ways that the regional center is not supporting him to lead a completely self-determined life, purely because they're not offering him the person-centric supports that he needs. And it has taken 8 months, 9 months for them to be able to add an addendum to his budget, or even for any kind of assessment of rate changes that need to be included in his budget. David has not had the opportunity. So he feels that while a traditional model was able to offer him within minutes, they were able to get the support. They're not able to get that through self-determination. It takes very long. So he says that needs to change. Did I get it?
Yeah, and also, you guys don't understand also that I am only asking for what I need to do what I want to do, which is being involved in politics.
He says all that he's asking for is what he needs. For example, he's having to give them as to how many times a day he needs to be changed, or he needs to be taking a restroom break, so that he needs the two people to lift him or provide him the support. And he says that completely is undignified, and they should not be fighting him on such basic things. So that's you know, the people who do not have lived experience should not be should at least have the humility to look at what the person-centered needs are before making any decision as to what will be authorized for them.
Thank you, David and Kavita. Katie, did you want to?
Yeah.
I know that. Go ahead.
Oh, well, you know, there's so many questions in the chat and they're so valuable. I don't know how to pick and choose which one of those we'd be able to get to. And I think there's some common themes there. So offering that DDS and State Council can partner together to look at those questions and get back to people with questions, see if there's some way we can create some frequently asked questions around that. So just really recognizing that we would love to be here all day with you and answer all of the questions. Let us take those back and see what we can do. The other point that I just wanted to say was really appreciate, I think Vivian, Christiana, Kavita, who all mentioned spending plans as a point of potentials that we can look at. That was really my wrap up too, is that's something really actionable that we can work on collectively. So offering for anyone to send over spending plans that look great to them or that have been user friendly for them, or what's not working about them. I think there's some enhancements and improvements that we can really look to in the next coming months, year, that can really operationalize the spending plan, standardize it. We can look at those procedures. So welcoming conversation around that moving forward. And I'll throw our SDP inbox in the chat to everyone, and please feel free, send it all. Send all of your thoughts on it. We're really eager to hear everything.
Thank you,
Katie, I'm
Katie.
glad. Oh, sorry, Robin. Katie, I'm glad you stayed to provide last comments. As we wrap this up, I personally, of course, have been involved on this committee for, I don't know, 6 or 7 years, it seems. And one of the things that always strikes me is that many of the complaints and recommendations they don't change over the years. And there are, on the other hand, there are many new ones, and we get different perspectives from individuals based upon their personal experience. And I think all of it is valuable. If I put my cynical hat on, I would say, why do we have to hear the same complaints all the time? Why can't we make progress? Well, if I put my optimist hat on, I would say, well, the more we hear about it, the more likely it is that the issues are going to not just be addressed, but resolved in a way that's positive. Because when the question was put, I think from Judy Mark, what do you fear most about the self-determination, the future of the self-determination program? I think that was the question. My fear has always been that there are not going to be enough people in it for it to take hold, right? So now we're in excess of 5,000. That's a whole lot better than 1,500. My hope is that the momentum that can come out of a town hall such as this is such that it will encourage people who are in to stay in. And it will encourage people who become aware of it to think about joining. Because, and I'll end with this, I saw popping up in the chat, I think it was the chat, Christine Morales, let me see, where is that? Who said, Oh, here it is. Even with issues, my son would never give up SDP. And I can tell you guys, whether you've been in it for 1 year, 6 months, 6 years, or in my son's instance, 25 years, we're so fortunate. Our lives have been immeasurably impacted by self-determination, and it has been hard or challenging. Let me use that term. It has been challenging all along the way. It was challenging in the beginning because we didn't have any rules. It's challenging now because we have rules, many of which are not being complied with, and many of the issues relate to communication and timeliness on the part of FMSs, which I think is the biggest roadblock. But we're here to hear you guys. We have to synthesize the information, to make recommendations as a council to DDS, and ultimately to create a report, hopefully, which is going to inform either further policy or advocacy efforts. And so with that, Robin, unless you and Beth have something more or different, what I'd like to do is close this meeting 4 minutes early. That might be a record in all these years, but it's a record that I'm happy with and proud of. And in the event that you've got more, there are a whole lot of resources out there and individuals who have been on this Zoom that you can reach out to with your comments, questions, concerns, and most importantly, that would be the Ombuds office. So, Robin, do we have anything else?
I do not believe we do. I just wanted to call out a question from one of the committee members. Pierre had asked if committee members could get a copy of the things that were put in the chat today, and that is going to be folded into the report that everybody's going to get. So any questions or themes, like if all of that is going to all be folded into a report that's going to go back to the SSDAC to review, and it's going to be shared publicly and posted on the website.
All right. With that, thank you everybody for attending, and for those who had the temerity to actually make a comment or ask questions. We like them all, and we will see you next year. Have a great holiday to all of you, and we're going to wrap this meeting up. We'll see you